The Health Department has remained mum on reports that government could this week do away with the remaining COVID-19 regulations. In a government memo to health MECs that's leaked on social media, Health Minister Dr. Joe Phaahla says South Africa has now exited the fifth wave and could consider easing certain regulations, including the wearing of face masks in public. The ban on gatherings and restrictions on travellers entering the country could also be repealed. The country is seeing a significant decline in the infection rate as well as hospital admissions. Officials are expected to meet today to further discussions. All right, let's talk about these developments around South Africa's COVID-19 response with medical expert and convener of the Progressive Health Forum, Dr. Aslam Dasoo. Dr. Dasoo, always good to have you on the channel. So would you say that it's about time that this happened?
Good afternoon, Temekile. Good to be with you. Yes, it's beyond time that this happened. In fact, all of the proposed changes, I mean, this is a draft document, as you mentioned, that will still be ratified. But the proposed changes were all on the cards from months ago. And, you know, we went through that process of shifting the regulations from the Disaster Management Act to this and National Health Act. And I think all of that was just a series of unfortunate delays, but this should have happened a long time ago. Yes.
You say a series of unfortunate delays, but would you say that the government's, shall we say, rather safe than sorry approach to managing COVID-19 has served the country well?
Look, I think every government would rather take a more cautious approach than being reckless in such a situation. I think there was probably an overabundance of caution, and I think it was not well founded on the science. You know, just listening to your previous interview, that entire era of state capture so weakened our state system and its ability to respond to a massive threat like a pandemic. You know, was seriously attenuated, and we felt that. And not only in the way we responded, but in the decision-making around how we responded, with the government in a bit of disarray and, you know, delaying with the onset of vaccinations and rolling it out and so on. It was, like I said, quite a blow to the country. We had an economic meltdown, 2 million jobs lost. And I think the lockdown strategies and the various other strategies like the mask mandates and so on, we learned as we went through that pandemic what was working and what wasn't. And there was some time ago that we knew that, okay, as soon as the Omicron variant emerged, we felt that there might be a step change in this. And in fact, the epidemiology of the evolution of the virus is making it clear that we are on a different pathway. Of course, the WHO and the government has to be cautious, nevertheless, you know, because we can never completely predict the viral behavior into the future, but it's looking in a way that we can say, you know, we can all be cautiously optimistic.
But are we going back to life as we knew it if these changes do indeed come into effect? Are we going back to February, let's say, of 2020? Can we ever get life as it was back again?
You know, I'd go with answering your latter question, and that would be most likely not. You know, pandemics alter societies when they occur. And we have seen so much change over the last 2.5 years, that I think to expect that we can simply switch, you know, flip a switch and go back to 2020 February is you know, a fantasy. We have changed, not just in our behavior, but in the structural changes to the economy and to society that we have seen. Also, I think there has been an escalation in knowledge about the natural world, you know, through the people understanding more about how illnesses occur. Unfortunately, that is not being translated into progress yet. So I think what we do need to think about is not the pre-pandemic normality. It's not even a post-pandemic normality, because this bug's going to be with us forever and a day. But it's about how we can reorientate ourselves without having to worry about, you know, artificial restraints on society, on the economy. And I think with the learnings we've had in the last couple of years, these changes practically eliminate any material restriction on people to do work, to recreate and so on, and travel normally.
How far are we, Dr. Dasoo, then, from a post-pandemic world? Will we ever get there?
Well, as I said, I think it's how you view it. So we are in the emergency phase of the pandemic. That means the virus is circulating globally and it's infecting and it's causing deaths more in other places than say here. But we may be in a lull, and we may be, I hope not, but we may have some surprises in the future. But until this virus completely becomes what we term an endemic, such as with the flu and other seasonal viruses, we are still in that emergency phase. However, the Omicron wave has created the understanding that we may be on the pathway to endemicity, to exiting this emergency phase. That's what you can say, and we can have some latitude in our terminology and say we are post-pandemic. But it will be endemic. That means it's going to be with us. And, we will need to protect ourselves when it surges. We will need to be vaccinated fairly routinely, as we do take vaccines for other illnesses, especially for people at higher risk. And I think that's probably what our future in respect of the virus is going to look like.
Right.
What our future in respect of what we do and how we work and how we think and how we live, that is still an open question.
Goodness. It would take a conversation about COVID-19 to suddenly get me coughing. I wasn't coughing all along, but I did want to ask you some of the COVID nerves remaining. I wanted to ask you, Doctor, about masks and restrictions on gatherings. Have they become completely useless?
No. Look, in settings like hospitals and so on, masks are routinely used for very good reason. And it's a very logical reason to use it. However, mass masking is not masking really. It's a set of, hit and misses where people, if you don't say have an N95 mask or a very high grade medical mask, you're actually not doing much in terms of restricting transmission. And most people who can't afford to buy even medical masks in the pharmacies and so on are using cloth masks, which are less than useless. So it's a question of whether this compulsion and the demand and a mandate from the state continues that to ordinary people. It's moot at this point, because we know for a fact that masking at this stage, and certainly maybe perhaps straight off the Delta variant, is not providing any further protection at all. Certainly, I think the gatherings issue is now falling away as well, because if you're not going to have masks, there's no point in restricting gatherings and making social distancing an issue. And that, of course, then just naturally cascades to the issue of travel. And these are the three big areas that I think the new announcement is going to be about. And in light of what I've said, I hope they do away with them all completely. I think we are all pandemic veterans, and we can look after ourselves, certainly in this period.
And that point then, fellow pandemic veteran, let's leave it there for today. Dr. Aslam Dasoo, good to have you on, as always.